FARAPULSE catheter has a specific design which has been made for the catheter for the PFA ablation. And this is not the case for other catheters. And it has two specific forms, one balloon and one floor forms, which can be also used for the posterior wall ablation.
One of the most advantages of FARAPULSE, according to me, is the safety of the procedure. The time of the procedure is very important, and I find it such an easy procedure with less risk of complications, which will change the way that we are doing electrophysiology in our daily practice. The reason why I'm saying this is because the patient profile will change. There are a lot of patients that previously we didn't dare to perform an ablation, especially in elderly patients. But a procedure with FARAPULSE with less complications will allow us to do even more procedures to treat even, for example, elderly patients, because it's such a safe procedure.
I think the most promising is the simplicity of the procedure. I mean, somebody who has been doing for 15 years, I think, atrial fibrillation ablation point by point, and have faced several new technologies. I think for us, what's very special about the system is that the procedures are very straightforward. The learning curve is very short, and the procedure is very simple. So I think that's an important advantage as compared to the past.
I think that FARAPULSE is leading the field of electrophysiology and about safety, efficacy, and clinical outcomes are really promising. So I think that this is the main promise of this technology.
Well, first of all, the ease of use. I think the learning curve is quite steep. The results are great. We see that the performance is great because the ablation time is very short, which limits also the complications. Results are coming out and are very promising. Even the comparative study showed that the results are really up quite high.
For starters, PFA is a new platform, and FARAPULSE is a catheter that delivers it really well. It's a very simple design which can be used by anyone, I think, even physicians that are starting to learn PVI, and it's very suitable for first PVI procedures, in my opinion. It differs from the other modalities. It's not thermal ablation and it's not point-by-point ablation, so it's like a single-shot pulse field catheter, and there's only one in the market that does it so far.
What is promising about FARAPULSE? Electroporation by the means of this fantastic new catheter, which is FARAPULSE, the FARADrive, will permit us to treat many patients that we wouldn't have been able to treat before because of its safety and because of the efficacy that we're seeing.
I think the really important thing about PFA is, if you look back, it has been almost 25 years ago that Thijs Heijgert described the pivotal role of pulmonary veins in AFib, and we've been searching for an energy source really helping us to isolate the veins in a permanent and safe way. And I think that FARAPULSE is just ticking all the boxes. It's safe and efficient.
I think what is promising about the FARAPULSE technology is the fact that it's a PFA-based procedure, which will allow us to achieve persistent and long-standing PVI isolation with our patients.
I think the electroporation way of ablation is of great interest because we have efficacy, as a recent study proved, and we have less complication for when we compare with other energy. So I think FARAPULSE is easy to do, is reproducible, so it's in first-line ablation, it's a good solution.
I really think that FARAPULSE is a game changer in the treatment of atrial fibrillations, since it allows us to perform PVI easily, safely, and quickly with good short-term results.